Hi, this is Catherine McNeil, and I did my lower extremity compression bandaging on my right leg. So the compression gradient is 100% at the distal end, 70% at the mid extremity, and 40% at the proximal extremity. So I'm going to show you all the different views. This is the medial view here, and then we're going to move to the anterior view. This is the lateral view of the extremity. And then the posterior view is a little bit more difficult, but it's there. And then that is the bottom of my foot. I'm going to zoom in on the toes here, where you can see this kind of coming apart because we used it multiple times. But I would do the capillary refill here, and my patients would not have nail polish on, and I would just go here and see the color returning, but since I do have nail polish on, I can do it up here. And the color returns within 2 seconds, which means this is not too tight. And when I would ask my patient the goal, so what is supposed to happen is that the tightness should be rated at a 7 out of 10. And then now I'm going to show the active range of motion so that I can dorsiflex, I can plantar flex, I can invert and evert my foot, which means it's not too tight. So then now what I'm going to do is take the wrap apart and explain how I did this. So here it's just loosely taped. I used normal tape, but this would be taped on because I had extra bandaging, so you want to make sure it's just loosely on and it's not too tight. So what I used were short stretch bandages. So the first one that I'm going to take off is the largest size with the greatest width. So that's here, and we're going to start taking this off. So there was some extra there, so just have that on lightly as we unravel this. Sorry, I'm doing it with one hand while I record. So because this is the last one that I put on, I only started this at the ankle. So that was the largest width, and then the next one is going to be smaller than that, and I'm going to unwrap it. See, I used some tape. I'm going to unwrap this. This is the middle width bandage. And this one I did start down at the foot. And you start in the opposite direction from the first one that you did, and the last one you did. So there is the heel ankle sole that I did with this bandage as well. Okay, and then the one that's on here is the smallest width, and that's taped too. So we're gonna unravel this. This was all done 50%. So here you can really see the heel ankle sole where we wrap it around there. The heel's coming off. And 50% is shown. And then right here you can see the cotton layer. So we're going to take this off too, and because I had extra, it ended around the middle of my leg. So I'm trying to find that to unwrap it. Oh, there. Sorry about my camera work. And then underneath the stockinette, underneath the cotton layer is the stockinette. But we didn't have this in our kit. And the stockinette is applied after the gauze that's on the toes there. Sorry, as I unwrap this quickly. And then the toes here. And then I'm going to start talking about my patient education. The compression is used during the intensive phase, and it should be worn at all times. Once the girth measurements plateau and there is no reduction in size, then you can move on to the maintenance phase for that extremity, where the patient will be fitted for compression garments that can be worn during the day and alternative wraps that would be worn at night, and a patient should always exercise with their compression bandages on. Thank you, and there are my clips that are going in the garbage.